Welcome to the CALCiViS webinar hosted by The Probe. My name is Flo and I'm a dental hygienist and a product specialist with CALCiViS, and we have a really exciting webinar that is going to give you tremendous value in how you diagnose and manage dental caries. You are going to discover how bioluminescence technology is helping dentists to, for the first time ever, truly know if a suspected enamel lesion is actively progressing or not, and how knowing the activity status of a suspected enamel lesion will give you confidence in making the correct clinical decision. We will also share with you how powerful the visual image is that the CALCiViS imaging system creates, and how that really aids communication to the patient and actually puts the ownership and helps to place the ownership onto the patient. Joining us on this webinar is Dr. Christopher Longbottom, who is both a paediatric dentist and leading cariologist, and was the inventor of the CALCiViS imaging system. Also, Bruce Vernon, who is the Chief Technical Officer and the co-founder of CALCiViS, will be joining us. And towards the end, we are going to have Dr. Leanne Branton of Southside Dental Care in Edinburgh, who's going to share with you her first-hand experience of using the CALCiViS imaging system in her practice. Before we get started, I'm going to share with you a story. Chris always knew that if he could find a way of identifying free calcium ions in demineralisation, he would have the way of dentists being able to detect early and detect activity status accurately. In 2005, Chris travelled from Dundee to the US to attend a dental conference, and part of the programme in the dental conference wasn't so appealing, and he wandered off and found a bookshop. In the bookshop, he discovered a book called Glowing Genes by Mark Zimmer. And he was really interested in the science behind bioluminescence in certain plants and mammals, and that produce light. And he was particularly, he got quite excited when he saw a particular part in the book. And that part was where he discovered that a scientist had identified a way of identifying the calcium in cells using photoproteins. And what the scientist was able to do was was able to see the calcium in a microscope. He was so excited at learning this. He just, I think he saw all the possibilities of his lifelong mission with what he was trying to achieve. Chris contacted the scientist, and behold, was from Edinburgh. So the journey started from Dundee to the States, back to Edinburgh, and then the scientist met with Chris and they did some initial research. In 2012, the company CALCiViS was started by Adam Christie, who's the CEO, and Bruce Vernon, who is the Chief Technical Officer. And in 2019, today, we have a commercial available system that dentists are using and actually getting the benefit from. I am so lucky because I've had the personal privilege of working with Chris. I worked with him in Dundee Dental Hospital as a dental nurse and laterally as a dental hygienist, and I have got an absolutely clear memory of his passion that he had in his caries research, and the passion that he had and the dedication that he had to teaching the undergraduate students. And it's really great because the students that the students that Chris taught, some of them are our customers now, and they also they remember his teaching so well. So it's a really great pleasure for me to be back in a company that has started from Chris's research. I always remember the story that Chris told me about the time when himself and David Ricketts, another leading cariologist, they set off to determine if they would indeed come up with similar decisions about whether these teeth were active or not. So what they did was they had 20 extracted teeth. All of them had lesions on the teeth, and Chris identified that 18 of the 20 teeth of the lesions were active, and David, when he looked at the same 20 teeth, identified that 18 of the teeth were inactive. So I will just leave you with that thought. I'm now going to pass you over to Chris Longbottom, and he's going to explain to you where the CALCiViS approach came from, discuss the steps involved in caries diagnosis, discuss the key elements of lesion staging, and discuss the key stages of lesion activity. So please have your notepads and pens ready as you're watching this webinar if there's any questions that arise. We will be answering questions throughout the webinar, and I am absolutely delighted to now pass you over to Chris.
So where did the CALCiViS technology concept come from? As Flo has pointed out, technically it was in a bookshop in Baltimore, but there's a lot more background to it than that. So, first of all, what I'm going to do is to ask you to close your eyes. I'm going to say a word, and I want you to imagine just the image that comes into your mind straight away. And the word that I'm going to use, once you've closed your eyes, is caries. And the image which floats into the mind immediately of almost every dentist I've asked that over the last 30 years is a big brown hole. And this brings us straight away onto the question of what do words mean in dentistry. Caries is a strange word. It's a singular word with an S on the end of it. And it describes the disease process. And yet what you thought of, what your image was a big brown hole, which is a lesion. And so we've got a difference between a disease process and a lesion. And the disease process involves losing ions right through to the big brown hole and every section in between. And here's an image of one of the earliest stages at which a dentist can actually see the disease process, which is a white spot lesion, which you're all familiar with. And that's, at that point, there's been a lot of ionic loss from this tooth. But that's the first optical clue that you get that the disease process is in action. And here you can see total destruction of enamel of one tooth. There's effectively your big brown hole. So diagnosing the disease process, diagnosing the lesions, involves a number of steps which we as dentists actually complete in a very short space of time and concertina these processes together. First of all, what your brain does is to detect something is abnormal. You then characterize it, you make an assessment of what it is you're seeing which is different. And as a dentist, you make a judgment, if you've not already made it, of what this risk is of this patient has of developing the disease and of the disease moving on. You do that at the patient level, and you do that at the tooth site level as well. And when you've gathered all that information, you assimilate it all, and you make an assessment. You put all that information together to produce a diagnosis. And normally dentists tend to do that in a very short space of time. And all these steps are subjective. They depend on a number of different factors, which we don't have time to go into today, but they're highly subjective, some more subjective than others. Just to give you an example, here's an image of a 14-year-old patient, the teeth of one of the upper quadrants, and I want you to focus on the upper second premolar. And the mesial aspect of it, there's a little brown stain and a little bit of opacity around about it. And this was on a student clinic when I taught many years ago, and I asked the student just to open that up a little bit to find out what was, if there was a problem. And to cut a long story short, the problem was that the caries had reached into the pulp and it was exposed. And this just wasn't a ham-fisted student. I actually exposed that because I'd told him to stop when he got deep. That shows you the difficulty of detecting and diagnosing caries. What you've got there eventually is a big brown hole, but on the surface it was just a little brown spot. So, quite a difficult process. And what it should do, your diagnosis should specify at what stage the disease process is and whether or not it's an active lesion or an inactive lesion. Is it signs of disease that is actively progressing, or has it stopped? Is it effectively scar tissue? Has it arrested? So the purpose, obviously, of diagnosis is to inform and optimize your treatment decision making. And essentially what dentists are faced with is three options. They can either watch the lesion to see if it changes over time. They can paint something on it, like a fissure sealant or topical fluorides, or they can drill into it. They can actually cut a hole in the tooth. Those are the three essential options you've got, and your diagnosis will inform that decision. And as we all know, prevention's better than cure, and the earlier the stage we can sort of identify that disease process, we can detect a lesion, diagnose it, the better the chances of arresting and reversing that process. A few years ago, a group of Cariologists got together and decided to try and codify how dentists describe lesions. They tried to stage the disease process. And we tried to put together a systematic approach to lesion staging, which reduced some of this subjectivity. And it's been around now for, well, over a decade in academic circles, and it has got a relatively high degree of reproducibility. We think it's fairly robust. It's not perfect, but it has some robustness to it. The activity assessment, however, is a little bit more difficult. It is really still subjective, and although there is some evidence to support it, it's still in the sort of early stages in terms of visual and tactile assessment. Here's an example of some of the ICDAS codes. ICDAS means International Caries Detection and Assessment System. And here's a code 1, where you can see a white spot lesion just at the entrance to a fissure of a tooth. Code 2 is a similar sort of stage, but code 1 you can only see it when the tooth is dried. Code 2 you can only see it, you can see it when the tooth is wet. Code 3, the next stage along, is where the surface of this lesion starts to break up at a sort of micro level. It's not microscopic, but micro to the eye. You could just see there's some loss of surface integrity, which shows itself as either a slight widening of the fissure or little like woodworm holes in the surface. Code 4 is where you don't get this breakdown of the surface, but you get shadowing, underlying shadowing from the caries process in the dentin, but there's no surface cavitation or microcavitation. Nobody really needs an aid to diagnosis when you've got a big brown hole. You don't need anything else to tell you. Your eyes tell you. The assessment of lesion activity is the key element in the diagnostic process, since it will help determine the treatment decision. Obviously, if a lesion's arrested, it will generally require a different treatment option from that of a lesion which is actively progressing. Here's an image from nature, which is obviously showing us activity. It's frozen in time, it's an instant, it's a one-off, but we all recognise that there's activity going off there. So, is there anything analogous in dentistry on a surface of a lesion which might be able to give us that sort of information, which might say, yes, this is active, this is not? And what we've got initially is our visual information and tactile. We use some kind of probe to run over the surface. Visual tactile methods for activity assessment are recognised as being highly subjective. The visual aspect involves trying to judge whether a lesion surface is glossy or matte. One man's matte is another man's gloss. This is not a precise science. The tactile aspect involves trying to judge whether a lesion surface is smooth or rough. Again, one man's rough is another man's smooth, and it's not a precise science. Showing that IC code 2 image again, is that glossy or is it matte? Or is it somewhere in between? Highly subjective. The current methods of assessment, the additional methods like radiographs and other aids to diagnosis or detection, are got significant limitations, especially in terms of the time frame. You can take a radiograph to see a change. You take a radiograph months later, so there can be significant movement there. But there are all sorts of limitations for any of these other techniques. As an example, which Flo has already talked about, I sat down with one of my colleagues, Professor David Ricketts, and we examined 20 teeth, each with a lesion on, in the laboratory, so ideal conditions, no patient on the end of it. We coded them all, purely and simply for activity, not the staging. So here we have 2 Cariologists, and there's not many of us around in the world, both of us on this ICDAS committee. Between us, well over 50 years of collective experience of studying caries detection and diagnosis. And the result was, we both scored them 18 versus 2. David scored 18 inactive and 2 active. I scored 18 active and 2 inactive. So completely the sort of obverse results, which just demonstrates how difficult this procedure is, and how subjective it is. We're familiar from the last sort of 40 odd years of research about the chemistry of activity of the caries process. It's well understood. Acids from the biofilm seep into the tooth, start to dissolve the ions, metal ions from the enamel hydroxyapatite, releasing calcium ions into the fluid within the enamel pores at the enamel surface. And we know that the calcium ion concentration within enamel fluid increases actively, inactively demineralizing enamel. So the question is there any way to image this submicroscopic increase in calcium ions within enamel pores when the enamel is actively demineralizing? And the answer is yes. In nature, there are a number of bioluminescence phenomena which involve light being emitted when specific chemicals react with calcium ions. For example, bioluminescence in jellyfish. And this was where I tripped up over a book in Baltimore and discovered the bioluminescence phenomena with calcium ions.
Glowing in the ocean, jellyfish and other marine organisms emit a natural light show. This is bioluminescence, a chemical reaction that produces light for communication. Innovative dental imaging company CALCiViS also uses bioluminescence for the early identification of demineralisation associated with caries and erosion. The CALCiViS photoprotein produces light when it reacts with free calcium ions released from actively demineralising tooth surfaces. In this way, the CALCiViS imaging system supports a beautifully minimalist approach to prevention, using light to guide early intervention and stimulate patient communication and understanding of the value of preventive dentistry. To find out more, speak to CALCiViS or visit www.calcivis.com.
Wow, what great insights from Chris with his wealth of knowledge in studying cariology. I've actually taken some notes, really just to summarise Chris's part, because it's so, there's so much information there that he shared. And a couple of key points that I think were really poignant and that stood out are obviously the conventional methods of lesion staging and activity assessment are highly subjective. And again, these assessments are crucial to optimising the decision making in relation to the treatment for the caries lesions. Calcium ions are released in demineralisation, And bioluminescence offers an opportunity to image these calcium ions during the caries process to help identify active demineralisation. I'm absolutely delighted to now introduce you to Bruce Vernon, who is our Chief Technical Officer and co-founder of CALCiViS. Bruce Vernon has a Master's in Immunology and has extensive experience in designing, developing and commercialising medicinal products and medical devices. He started within NHS research laboratories and moved to senior management positions within FDA and MHRA regulated drug and device manufacturers. Bruce has led the programme from Chris's neat idea to having a clinically approved medical device to what we have now. Bruce is going to talk you through the CALCiViS imaging system, the science behind the product, the proof of the concept studies, and validation of the system in a clinical setting. So I'm delighted to pass you over to Bruce Vernon.
Thank you, Flo. So as you say, I'm going to talk a little bit about the CALCiViS imaging system and how it gives us some additional information about the dynamics of demineralisation. So I'll cover, as I say, how the system works, a bit of the science behind the technology, some of the proof of concept studies that we've performed, and how we've validated the system in the clinical setting. The current tools available are very subjective, but not only are they subjective, they're quite retrospective. So we're seeing historical damage to the tooth surface rather than what's actually going on with the disease process. So the CALCiViS system allows us to visualize the active demineralisation, and that gives us a chance to see which lesions are actively deteriorating and which are maybe arrested. It also allows us to see the switching off of this process and the effectiveness or not of the interventions that we use. So if we look at this slide with the images, so we've got images from an intraoral camera and images from the CALCiViS system. And if we look at the intraoral image, we can see this classic white sort of chalky area, which any trained dentist will tell you is indicative of demineralisation, of active stance on that lesion. Well, it's very difficult to explain that to a patient. But if we look at the CALCiViS images, and we can see these clear hotspots of activity where there's calcium leaching away from that crystalline structure, it's much easier to present that to a patient. So how do we obtain these images? So again, coming back to the crystalline structure in the enamel, when that comes under attack from acid, calcium ions are released. It's a normal chemical process, and that's demineralisation. We also see remineralisation when calcium goes back into the crystalline structure. But what we're seeing is in the case where demineralisation is outstripping the remineralisation, we start seeing the crystalline structure breaking down, little pores and pits where we get the calcium ions accumulating. So with CALCiViS, we have a recombinant photoprotein which reacts very specifically with those calcium ions to give a burst of light. And it's quite important. A couple of things to note is this is not fluorescence, so we're not shining an excitatory light and looking for a change in the light coming back. We're actually looking at a direct reaction between the photoprotein and calcium ions that releases this light. And the other point to note is that the photoprotein cannot bind calcium that's in a crystalline structure. It just can't get to it. So in a normal crystalline structure in the enamel, we can't actually get a signal. It's only when that calcium is set free and sits there ready for the photoprotein to pick up. So it all sounds very simple, but there's a number of challenges in putting the system together, and one of the challenges is the speed of this reaction. So the photoprotein actually reacts within milliseconds. So if we look at the flash dynamics in this chart, we can see that the peak output of light is within 10 milliseconds. And if you've left it by a tenth of a second, the signal's gone completely and you won't see anything. And Chris has had issues with this in the past where, and also us as well, when we've tried to image teeth, and I know Chris had freshly extracted teeth that he would run down to the lab to get it into a dark room to get the images performed, and then turns around to the technician and says, "Okay, go." And the technician says, "What do you mean?" He says, "Put the photoprotein on." He says, "I've already done it." He says, "Oh, well, we must have missed it," because it is such a quick reaction. However, the way we've got round this is using a system where we can integrate a syringe drive into an intraoral camera. So it's a very sensitive intraoral camera that picks up this very faint flash of light, and the photoprotein is drawn into the syringe, slotted into the belly of the machine, and an applicator is clipped on the top. Now the applicator has multiple functions, so the applicator will prevent cross-contamination from patient to patient, will also channel the fluid onto the tooth surface from the end of the syringe, and will block out any external light. So by positioning it over the tooth surface of interest, we can get a live video stream. And what I'll do is I'll show you a brief video clip just showing what this looks like in practice.
Once the syringe containing the photoprotein has been loaded into the system, the software allows for patient details to be entered, either for a new patient, or alternatively, you can select a patient who has been imaged previously. Once the patient has been selected, the software then moves into the image capture mode, where it is possible to select the tooth and the tooth surface, which initiates the live video stream. From this, we can then place the device over the tooth of interest, and then once it is correctly positioned, it's simply a matter of pressing the initiation button and the images are then taken. Two images are taken. One is a visible image with the LED light on. The other just provides an image of the tooth surface for positional purposes. Secondly, the LED light switches off. The photoprotein is applied to the tooth surface automatically from the syringe, and a second image is taken in the dark, where we are picking up just the bioluminescent signal from the photoprotein and the reaction with the calcium ions. Looking to the right hand side of the image, we can see a scale which ranges from black through blue and up to red. If we hover over aspects of the tooth surface, we can see in these areas there is little to no demineralisation, whereas in other areas we can see relatively high levels. The two images are then blended together. Again, this all happens automatically, and it's possible to vary the blend from fully visible to fully luminescent, or anywhere in between. Once you are happy with the blend, click on the next tooth. Choose a tooth, select the tooth surface, and again a video stream is initiated. It's then a simple matter of positioning over the tooth surface to have it correctly positioned, and again press the button and the two images are taken. So one visible image showing the tooth structure and the second one showing the luminescent signals. This is purely the reaction between the photoprotein and the calcium ions, showing hot spots of high calcium concentration, which represents high levels of demineralisation. In the blended image, we can see clearly where on the tooth we have the hot spots of demineralisation. When we're happy with that, the session can be completed. The images are saved and the system is then ready for dismantling. An additional function of the CALCiViS imaging software is the image gallery mode. If you click on image gallery mode, you can then select any of the patients that have been imaged previously and can look at all of the images that have been taken in previous imaging sessions. If we click on the images as they show up on the screen, we still have the capability to see the level of luminescence on the scale to the right of the image. And the additional functionality is that we can actually show up to 4 images on the screen, which can be useful for tracking the same tooth over several sequential images, which may be taken several months apart.
So that's how the system works. Obviously, we needed to generate proof of concept data to ensure that what we believe was happening is genuinely happening. And one of the things that we clearly needed to confirm was that we are detecting calcium ions. So this is a relatively simple experiment where we made varying concentration of calcium chloride into small microteter plates, and then we imaged each of those. And what we can see in this slide is as the concentration of calcium increases, the signal increases. And on the graph we can see there's a relatively linear relationship until the sensor becomes saturated and then it flattens off. So we are definitely picking up calcium ions. So we then wanted to see how this looks like in the tooth enamel. So we took a relatively sound tooth and we exposed it to acid challenge. So this acid is expected to cause a breakdown of the crystals and release those calcium ions. And we see in this time challenge where we have taken an image after 1 minute, 5 minutes, 15 minutes, through to 25 minutes of exposure to acid. And we do see again this nice dose response. So as the acid exposure increases, the amount of calcium being released and available to the photoprotein increases, and we get an increase in signal. So it's clear that we are able to show that on a tooth surface we have a similar experience. One of the other areas we were really keen to look at is whether we can see switching off of this signal. So we performed an experiment in collaboration with Klaus Neuhaus of the University of Bern in Switzerland, where he embedded enamel blocks into, or tooth enamel into resin. And we looked at sound enamel first, and you see the image on the left-hand side at the bottom. There's virtually no signal from the sound tooth. Klaus then exposed these sound enamel to a validated multibacterial broth which mimics the bacteria that's present in cariogenic plaque. And we can see here that after that activation of the lesion, we see a nice clear signal. And then the next step was to take those lesions that have been activated through this broth mimicking an active lesion. We then took that through a standardized remineralisation process to inactivate that lesion. And then when we took an image after that inactivation process, we can see the signals disappeared, which is great. And that actually can be a very powerful message for patients as well, to show that the treatment has been successful, provided we can pick it up early enough. So that looked at the data from extracted teeth. We then wanted to confirm that in a clinical setting this works. So we ran a multi-site study to perform a clinical, to generate clinical data that would be acceptable to the FDA. It was approximately 110 patients and 5 investigators that were extensively trained in the identification of active lesions. And what we did was we asked one of the investigators, or each investigator, to identify teeth where they believed there was an active lesion and an area of enamel which they believed to be sound. And then we asked them to image those, either the active lesion or the sound enamel using the CALCiViS system. They were only allowed to see the visible image, and they were asked to mark up on the surface where they believed the area of interest should be. Then we asked a second independent investigator to assess whether the luminescent signal or lack of luminescent signal correlated with the dentist's original determination of active lesion or no active lesion. And these are just a few images from that study showing a few examples of where the positive luminescent signal matches perfectly with the dentist observation. And overall, the results of this study were extremely encouraging. So firstly, and very importantly, there were no patient-related adverse events, and we saw a 91% correlation between the luminescent signal and the active lesion status, and a 98% correlation between the lack of luminescent signal and the sound surface.
CALCiViS is a highly innovative company at the forefront of enabling preventative dentistry. The CALCiViS imaging system lets you visualize active demineralisation as it happens for the very first time. At the heart of the system is the CALCiViS photoprotein. This photoprotein reacts directly with the soluble calcium ions released from demineralizing enamel. First, the device captures a visible light image. Then the photoprotein is applied, allowing the system to almost instantaneously visualize the resulting luminescence. Luminescent hotspots indicate areas of high active demineralization, which, even in the absence of cavitation, may need treatment with preventative therapies. Using imagery to explain the value of a treatment plan and demonstrate its success at follow-up will enhance communication between you and your patients. The CALCiViS imaging system will change the way we approach dentistry. CALCiViS, dental enlightenment.
So we'll just briefly summarize for the CALCiViS system. Then, so it's a very quick, simple to use system, provides an image within a second, as you've seen in the demonstration, which does make it real time. It's chair side and it's looking at differentiating active enamel demineralization from inactive status, and therefore looking at the likelihood to progress or not. It also has huge potential for monitoring early intervention to correct the damage that's maybe going on a tooth surface. It also provides this independent and more objective photographic evidence of treatment decisions to support those treatment decisions. But really importantly is it's a very powerful tool for communicating with the patient and increasing the patient compliance and commitment to taking care of their own oral health and hygiene. So with that, I'm going to finish, and I think we hand over to Flo.
Thank you to Bruce for delivering that. Watching that, the part that sticks out for me is the power of that visual image. I mean, we can't underestimate how much an image improves communication, and certainly an image as powerful as the CALCiViS image that comes up so quickly. And one of the key points that I hope that you have taken away from this is that by seeing that powerful image, it really does improve the communication, and it really helps to place ownership onto the patient so that they change and they prevent their disease. We are delighted to have won several awards for innovation, and now it is a pleasure to be working with the innovators of dentistry, where we are now in a position of serving our purpose, which is really to help both clinician and patient have valuable information so that we can create patient-led prevention programs with the ownership of disease on the patient. The third part of this webinar, we are delighted to have with us one of the innovators in dentistry using the CALCiViS system, Dr. Leanne Branton. Leanne graduated from Glasgow in 2003. Having spent the first 5 years of working in a mixture of NHS and private practices, she established Southside Dental Care in Edinburgh in 2008. This is a mixed private and NHS practice with a team of 18. and has also been a vocational dental practice since 2010 with a focus on prevention. Leanne carries out sedation in her practice and is currently undertaking the FGDP diploma in implant dentistry. She's a married mother of 2 and balances family life with constantly developing her clinical skills, as well as developing and growing her business. Her practice is already established and is busy. She's also undergoing changes both in the design of her building and with delivering more comprehensive care with strong prevention programmes. So it's my absolute pleasure to introduce to you Dr. Leanne Branton. So Leanne, what's been your overall experience with using the CALCiViS imaging system?
I found introducing the CALCiViS system to our practice to be a huge asset. In my experience, I find that patients are very visual creatures, and so having something to show them that helps to strengthen the message I'm trying to tell them has been hugely beneficial.
It's amazing, good. And I know that in the beginning you had some reservations of purchasing this system, didn't you? But what really made you purchase the system?
Well, as a practice, we've always been very prevention focused, and so the temptation to have a tool that would allow me to drive that forward within the practice was great. And I was fascinated by CALCiViS, by its concept and by its technology, but I struggled initially to see how I'd implement it into my daily workflow. I was very lucky though, because last year CALCiViS invited me to be part of a small clinical trial, and that allowed me to see firsthand the benefits it would give both myself and my patients. And to be honest, it was the patient's reaction to the technology that really made me decide to invest in the system.
Okay, so since then, since the trial, obviously you've purchased the system, how have you then integrated it? Because you were a bit unsure about that, so how have you actually integrated the system?
I decided to take a bit more of a gentle approach in integrating it into the practice. Last year I was converting my patient list from NHS to private plan, and so I used it as part of the business strategy to aid in that conversion. I wanted to give extra value to our private examination, something different and unique that I hadn't done for these patients on the NHS previously. And so we built in the fee for the CALCiViS screening into our plan so that our patients would benefit from a screening annually. And we also increased our private new patient assessment fee so that it would incorporate some CALCiViS screening as well.
Okay, so as a business strategy then, you were already moving towards private, and you've almost used this as a way to increase value in your exam fees.
Absolutely,
then,
yeah,
okay.
Absolutely.
And then you mentioned there about the new patients, so have you increased the fee of your new patient exam?
Yes, we have.
Yeah,
so
okay.
It includes a CALCiViS image in their first appointment when they come to the practice.
So it's almost like a selling point or a building value in your new patient exam as well, isn't it? And so when you're actually using the imaging system on your patients and you're capturing the images, how is that influencing your clinical decision?
I find that having the CALCiViS images alongside the information from my clinical examination, putting them together really increases the confidence in the decisions that I'm making. As I started to use the system, what I found was that in these more subjective lesions, there were times where the information that I gained from the images would actually cause me to alter my proposed treatment plan. And it alerted me to the fact that without the CALCiViS images, there was ambiguity and definitely scope for error. And unfortunately, we are facing ever-increasing litigation as dentists, and anything that helps to strengthen our records and to really justify the decisions that we've made, whether that be treating a patient or not, can only be positive in my mind.
Yeah, I think that's a really, really good point to make actually, certainly in today's world in dentistry. And when you're taking these images then, are you sharing them with your patients?
Oh, absolutely.
Okay.
I mean, one of the biggest benefits of CALCiViS is the improved communication that you have with your patients. You show them these images and they're new and they're exciting, and the patients are interested. And they're interested in what these images represent, and that allows me very naturally to lead into talking about prevention with them. And what I'm finding is that it helps me to get across the message that I've been trying to do for the last decade, but with more success.
So it's helping you to actually get the message out that you've been doing.
Yeah, they seem to understand it better once they can see something.
Well, that's really good. That's amazing actually. And when you've engaged with your patients, taking these images, what sort of reactions have you had from them?
It's been really positive reactions. I feel it really helps with the trust. You know, you're showing your patient these images, and they can see them and they can understand them, and then you're often saying as a result of these images that you're not going to do anything, you know, you're not going to treat them, you're not going to drill their tooth. And that's a really powerful message, because the patients start to believe that you are very much focused on preventing oral disease. And I also find when they see the bioluminescence, they become actively engaged, and it really encourages them to take ownership of what's happening in their own mouth. For me, I like to see the progressive images. So I've always applied fluoride to suspect lesions. And you know, we're taught that it's a very effective remineralising technique, but assessing the success of that is as subjective as assessing which lesions need it in the first place. And so it's very comforting for me to be able to put two pictures side by side that have been taken a few months apart and confidently say whether that lesion has now remineralised or whether it's still actively progressing. And I think that's very important information for me to have as a clinician. It's also important information to share with your patient again, because it shows them if the changes that they've made at home are enough and have been successful.
And I guess it's a bit like, I think that's really, really good. I think it's a bit, when I think of a perio chart, for example, so you take your perio chart, you note down your bleeding, you do your periotherapy, you get the patient back, you do your second chart, and you have comparison. But with caries, until now, we don't have that.
Compare. Patients like a challenge as well, so quite often if you can try and challenge them and show them if they've been successful, it can really help with to change their attitude around with regards to it.
It's involving them, isn't it? It's like it's really, really involving them, so that they're actually, you want your patients then to be almost hungry to be, what do I need to do to remineralise that tooth? To prove and to get we all like getting told we've done something well, don't we? So that's an amazing experience that you've had there with the patients. Leanne, you've really shared some great insights into your experience and the benefits of for you as a clinician and that the patients have experienced. How would you say that it's affected your business?
Now that I've been using the system myself for over 6 months, I feel more confident to roll it out to the rest of the practice. And my plan is to do this through our hygiene therapy service, so that all of our patients, both NHS and private, can start to benefit from the system. My mission is to produce a really comprehensive and strong preventative programme within the practice. And I think this should be led by our hygiene therapists. They play a key role in patient education and prevention. And CALCiViS gives them a platform whereby they get to use exciting new technology, but also build these relationships with the patients. I want my patients to start to value prevention more as well, and value their time that they get with our hygienists, and to see preventative hygiene appointments as far more than just a clean. And my hope is that to bring in our caries prevention programme, it's going to increase the hygienist's role and their worth and how they're perceived by my patients.
That's amazing. That just makes me happy as a hygienist. I think you've really hit the nail on the head when it's about more than a clean. Because so often practices have got the best intention with their preventive programmes that they're delivering, but sometimes all it is a clean, and actually even the receptionists and even some clinicians call it a clean, so it really devalues it. And I think by bringing in, bringing CALCiViS in a caries prevention programme and adding it into a perio-preventive programme, it's really more comprehensive, isn't it?
Absolutely, and it will make it easier to adjust your prices to allow for the CALCiViS screening. You know, the patient wants to know that they're getting value for money and what they're getting for that.
Absolutely, and I think your levels of communication and what you're delivering out builds value, and as long as you can explain exactly what you're doing and the benefits to that patient, they normally are happy to pay for it. And you've experienced that already. And then when it's on, I think you've done it really well actually, because as a dentist, as a clinician, you really want to get your hands on it. You want to understand and interpret the message and really get in synchronisation with it and what you can in comparison to looking at the teeth. But I think rolling it out to the hygienist as your intention and plan is definitely the way forward as we've described. So I think you've done it the right way though. I think you've done it really, really well. And when you think of your whole practice then, because your list is private, but you've got associates list that's NHS, and so is using the hygienist, then it's going to create a way of...
It'll create a pathway
bringing
to
those,
allow access for NHS patients to the CALCiViS system.
That's excellent. Leanne, can I finish off by asking what advice you would give to any dentists or hygienist therapists out there that are perhaps considering the system, the CALCiViS imaging system for their practice?
I think if you're serious about prevention, then CALCiViS is definitely a tool that you want to have within your practice. It will enhance your communication with the patients, and the patients value it and will start to trust you. And it's a powerful ethical message about how you are as a dentist and that you're really focused on disease prevention. And ultimately, it can allow prevention to be profitable as well. What I would say is that if you want to integrate it successfully, you have to be willing to invest a little bit of time up front. Firstly, to train your whole team so that they're all on board. And the great thing is that CALCiViS are really supportive in providing some bespoke training for your team, but also just initially to make your appointments slightly longer while you start to show the patients these images. Because they do want to talk about it and they want to have these conversations, but it's these conversations that will help you to change your patients' attitudes and hopefully ultimately their oral health.
So thank you so much for joining us on this webinar. I hope that watching the webinar has made you perhaps think about the complexities in caries diagnosis and perhaps ways that you can do it better. And I hope it's given you a good insight into the value that the CALCiViS imaging system provides for you as a clinician, for the benefit to your patient and your business as a whole to help you leverage new value in prevention. Please get in touch. All of our details will be on the last slide. Visit our website, our social media pages, you can call us. But thank you again for taking the time to watch this webinar. Thank you.